Okay, welcome everyone to the Miles for Hips interview with Dr. Michael Millis from Boston Children's Hospital. I'm Ashley Spalla, the board member for Miles for Hips Information and Education, and I'm wanting to welcome Dr. Millis for our interview today. Welcome, Dr. Millis.
Pleased to see you again, Ashley.
Always, Dr. Millis.
Always pleased.
We have some questions for you here today in regards to our Hip Dysplasia Team Week. It's all about the provider, the patient, and the caregiver all this week. And we wanted to get the surgeon's perspective in this process that we call patient care. So first of all, we wanted to start off with what is the training required to become a hip preservationist?
The training is, I think, the most important characteristic, to turn the question around a little bit, is that somebody be interested, genuinely interested in the well-being of patients with hip-related problems. So I think it goes beyond any specific interest in a specific technique, but I think that's a start. Because what you'd like, I think, your caregiver to be is somebody who knows how to do the surgery, if it's surgery that's required, but knows a little bit about the patient too. So in terms of specific training, if we're talking about surgical techniques, I think that one has to have had an orthopedic residency. And generally these days, that's still not enough. You need extra training, some kind of a fellowship. And then the truth is, if you're someone who a patient will feel comfortable with, you need a fair amount of experience. Well, you don't get experience instantly, but if you've had training at a good place with good people, then even somebody fresh out of a fellowship can do a great job. As long as they've been trained by the patients, and I say the patients are my most important educators, to listen and to pay attention and not just the images. So it requires several years. And the training isn't just technical. As you know, it's sort of cognitive too. So maybe that helps a little bit. Several years, lots of experience, not just in doing surgery, but in listening to patients and working out things with patients.
It's a wonderful perspective. Thank you. How did you become interested in patients with hip dysplasia or hip preservation? How did that come about for you personally as a follow-up?
My interest began by having a role model. My first role model in orthopedics, after my father, who was also a role model for me, he was an orthopedic surgeon, was Dr. John Hall, who was the chief of orthopedics at Children's Hospital. And it was with Dr. Hall that I first became aware of and experienced the care of patients with hip problems. And these were not only children at Children's Hospital, but Dr. Hall was such a great surgeon that a lot of adults who had deformities that started off in childhood would come to Dr. Hall because he was so good and so well known. And so it was Dr. Hall's influence that really pushed me in the direction of being very interested in patients with hip problems. That's when it started. And then I was fortunate enough to be pushed and nudged in directions that just kept me going.
That's very interesting. Well, we're very glad that you pursued that for us. Thank you. Looking back on your very esteemed career, what have you learned and would want other providers to know and other patients to know?
Okay, so the question is, what advice do I have to give other providers and patients? Is that sort of it, Ashley?
Yes.
Okay, well, I think the most important thing is never to be secure that you know it all, and always be attentive to new and different things. Because my patients really have been my most important teachers and still are. And every patient is different. And I think that that is probably the most important lesson. Even though I've seen, I don't know how many thousand patients with hip dysplasia, everyone is different. There are some patterns that are similar, and certainly pattern recognition is part of what helps us make sense of a crazy world. And a certain pattern of patient will benefit from a PAO, for example. But beyond that, there are a lot of individual characteristics that make all the difference. So my most important lesson is never to be secure that you understand everything about any given patient. Always be actively listening and actively trying to understand more than you think you do. So I think this is, and I try to empower patients. I mean, what I try to do is to let the patients understand they're the most important ones. The system is not set up that way. The system is set up so the doctor has a lot of the power. They're in their home court in the hospitals and in the outpatient clinics. But you guys are really the most important ones. And so I think I would tell doctors and patients that the more we can try to turn the volume down on the angst and turn the attention up on trying to get good information and trade information back and forth on an equal basis, the better it's going to be. The better I'm going to understand the patient, and the better the patient's going to understand what they've gotten across and what they haven't, because I think it's in misunderstanding that a lot of the problems come in medicine.
That's wonderful. That's a huge part of what we want to do at Miles for Hips is participatory medicine, is really bridging that gap between patient and provider and bringing them together. It's not wholly one person in this process, for sure. And of course we've been through it. But for new patients doing this is a very difficult process, and it's a lot to learn, and it's a lot to learn for doctors as well.
The systems aren't user-friendly for anybody. That's the challenge. But I think that often they are more user-friendly for the doctors than they are for the patients. And that's really unfortunate, because this should be about the patients.
What is the most exciting thing that's going on in your career field right now in hip dysplasia?
Well, in my career right now, after I've done, I don't know how many, I've lost track of how many PAOs I've done. It's over 1,000. That's not to brag. That's to say that now I'm trying to learn new things. And the new thing for me is understanding better the perspective of the patient, and to understand how to make the experience better for everybody. And I think the greatest opportunities lie not in technical advances, but they lie in optimizing information transfer in a lot of different ways. And that means better listening, better communication, better outcomes measures that aren't just called patient-related outcomes measures. They really reflect the patient's perspective, the patient's needs, the patient's interests. And we're getting there. I mean, I think that the way I would see our field now is, in terms of getting the patient's perspective, we are now talking the talk, although I would say a lot of surgeons still aren't walking the walk. So that to me is exciting. In other words, I'm learning new stuff all the time. We're finally getting a manuscript out on the felt experience of some of our PAO patients. And we picked a especially interesting group, which was women with children in their home their own children at the time they had their PAOs. Now, I don't think for anybody, a PAO is a piece of cake. Whether you're a 14-year-old who's got a family to take care of you or not, it's not a piece of cake for anybody, but we thought this group would be especially stressed. And so we thought they would reflect a lot some of the issues that everybody had, but might be more apparent in them because they had issues with people being dependent on them. And all of a sudden, they couldn't do all their caring things for their kids. So that to me has been really exciting. And now we're going to hopefully get it in print and hear what everybody thinks about it. So that's the most exciting thing for me going on now is I'm a student again. That's pretty exciting and pretty scary because I'm an old student, but I'm trying to learn.
We can always learn.
I hope so.
We can always learn. The learning process is a never-ending process.
Well, it is. And the patients have to be, it's best if the patients are in a position where they are listened to because they need to teach people about what's going on with them.
Absolutely.
That's really important, but it's a lesson that's only slowly learned, I think, by some.
Yes. What does the International Hip Dysplasia Institute, the IHDI, mean to you?
It means a lot of different things to me because I know the story right from the start. It's an interesting story. How a family with a child with a hip problem went to several different people and got confusing answers and was empowered enough financially and otherwise, fortunately, to finally say to the third expert, what's going on here? We don't understand. We've been to 3 experts and you've told us 3 very different things. How is one going to decide what's the best thing to do with our baby? And the rest is history, as you know, Ashley. This was a family with a lot of money. It's common knowledge who this is. I think it's Larry the Cable Guy who gave a lot of money, and they kept on saying to Dr. Price in Orlando, here, Dr. Price, how can we figure this out? I said, well, we need to do studies. Well, okay, Dr. Price, how can we help you do studies? He says, well, these things take money and time. That's why we don't have answers yet. How much money do you need? And he gave them a figure. It was a reasonably modest figure in terms of what they could afford. It was a modest figure. So the lady wrote a check right then. And it went on and on, up into the millions, as you know, Ashley.
Yes.
And to everybody's credit, they have built a foundation for research and helps patient care. They're setting up studies around the world. They do research. They help with diagnoses. They have a wonderful website that helps families, that helps patients of any age get good information about what hip dysplasia is at different ages, what different things are done about it, and it empowers people. It gives them lots of resources to learn. And in that sense, I think is an unbelievable addition to the orthopedic world.
Absolutely.
It's a great website. It's a great group of people, and I'm pleased to have had a very small part in it and still play a very small part in it.
Is there anything that you would like to say to, in your closing statement as the last thing for hip patients, or any advice for hip patients who are starting out in this process, or even veteran hip patients in this process?
I would Tell all of them that they deserve to be heard and they deserve to be given an opportunity to learn about what their caregivers think is going on with them and to understand and participate in their treatment programs from beginning to end as equal partners. I'm not expecting anybody who's a patient to be able to do the surgery, but they should be able to do closed loop communication and have some iterative, that means dialogue with their caregivers. And if they don't feel like there's dialogue, they should look elsewhere, because dialogue is an important part of getting the best information and making the best decisions. So I would say somehow find empowerment. And if they don't know how to get empowered, they should call Ashley Spalla.
Well, thank you. I appreciate that. Well, thank you so much for your time today, Dr. Millis. We
Sure, Ashley.
greatly appreciate that.